Sade. Now Papa dances in the stars and Mama calls you sweetheart. Sade is so beautiful, Sade is so smart, Sade is so wonderful, she's a work of art. Sade's blessed with everything she will ever need. Sade's the most magnificent girl you've ever seen. Sade is as magical as your wildest dream. You are a little dancer. You will be what you will be. And love is always the answer inside you and me. Sade is so beautiful, Sade is so smart, Sade is so wonderful, she's a work of art. Sade's blessed with everything she will ever need. Sade's the most magnificent girl you've ever seen. Sade is as magical as your wildest dream. Sade is as magical as your wildest dream. I always wanted a little girl with big blue eyes and golden hair. And when I felt the first flutter, the joy I felt was something new. And then they laid you on my chest, just perfect, and our eyes met, just perfect. You knew that I was waiting for you. Let's go out and play, skidamarink all day. You just go be you. The world is waiting for you too. You are my capable little girl, strong and smart and stubborn too. With such a big heart, you will go far. Keep God with you in all you do. Every day we are together, just perfect, just you and I, just perfect. You knew that I was waiting for you, so let's go out and play, let's get a marink all day. You just go be you. The world is waiting for you too. The world is waiting for you too. The world is waiting for you too.
All right, this is my little V. Here it goes. It's you and me, my little V. It's gonna be okay if you just breathe with me. I can feel your smile and your dancing heart. We're together from the very start. Oh, and there's nothing in the world that can take us apart. You fill me with strength and infinite love. Da 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 da, la Eyes glisten, spark through the night. Oh, your laughter and kisses and little sweet voices tickle inside. You are the sunshine of my life. Oh, you're the sunshine of my life. Ooh, my little bee. Yeah.
Sade is so beautiful, Sade is so smart, Sade is so wonderful, she's a work of art. Sade's blessed with everything she will ever need. Sade's the most magnificent girl you've ever seen. Sade is as magical as your wildest dream. A long time ago, we searched for each other. We created a life together. Our little dancer. We pray for you to grow and to always know love is the answer for our little dancer. Sade is so beautiful, Sade is so smart, Sade is so wonderful, she's a work of art. Sade's blessed with everything she will ever need. Sade's the most magnificent girl you've ever seen. Sade is as magical as your wildest dream. We listen to your heart beating like a drum. Couldn't wait for our little dancer to come. Papa gave you your name, our beautiful Sade. Now Papa dances in the stars and Mama calls you sweetheart. Sade is so beautiful, Sade is so smart, Sade is so wonderful, she's a work of art. Sade's blessed with everything she will ever need. Sade's the most magnificent girl you've ever seen. Sade is as magical as your wildest dream. You are our little dancer. You will be what you will be. And love.
Hello, everyone. I can't stop smiling. Welcome to Tough as a Mother, a year in review. This day promises to be incredible. May 5th, Maternal Mental Health Day in a big month. And we are so excited to be bringing this to you from the virtual Motherhood Center. Although Paige, as you can see, is sitting in our brick and mortar our brick and mortar center, which we so miss, but we have gone virtual this year so that we can continue to serve everybody and even a broader population, which is one of the upsides of this pandemic. But I want to thank everybody for being here and joining us today, and to our amazing speakers and panelists, and to the clinicians at the Motherhood Center and all the staff. So much went into creating this incredible day, and I think you're going to find it very interesting and thought-provoking and relevant. I don't know if anyone saw the paper today with the childbirth rates going down. I mean, just there's so many interesting things to talk about, and we are really excited. So I want to, we're going to talk much more about this later, but I do want you to know there's been a tremendous rise in perinatal mood and anxiety disorders, PMADs. That's the new PPD, postpartum depression. We go with PMADs, perinatal, so before, during, and after pregnancy, and that developmental stage into motherhood called matrescence. We will be talking about all that today. And what's so important is that this is hard for, I'm going to go out on a limb and say everyone. Harder for some than others, and for those who have illness, predisposition to illness, or are struggling more, will have a PMAD. And I want you to understand that they are totally treatable, and that is what we do at the Motherhood Center. We've had a doubling of our outpatient population. Our partial hospital, our day program is currently, we're about to move to a wait list, which makes me very nervous, because while it's great on one hand that we can help women who are really struggling, it also tells you that the need out there is so great. But these are treatable things. And I hope that what you learned today about this difficult transition that is both beautiful, hard, comes with all kinds of things, is messy, that when there is real illness and mental health disorders, that we can treat them. We know how to treat these things. And if it's not here, it will be somewhere else. And we just want people to get treatment, because no one needs to feel bad. This is important for women, families, and everyone. Okay, so I'm going to tell you really briefly about the Motherhood Center, and then I'm going to stop talking, and we'll move into the really fun stuff, interesting conversations. But I want you to know we are a treatment facility where we have 3 tiers of service. This is part of the education advocacy department, and that's who brings you this today. And in that area of one of our tiers, we do support groups, and we have many of them. And we have increased them and tried to meet the need in terms of what's out there and what demands, what we're hearing from our constituents and the women involved, women and families. We also have a big outpatient department where we do all kinds of things, from supportive psychotherapy to DBT to insight-oriented psychotherapies and different kinds of groups. And then we have our day program, which is really at the center of the Motherhood Center, which is our unique contribution to the landscape of women's mental health. Right now, where we are providing this intermediate level of care between outpatient and inpatient. So it's really for women to come every day, 3 to 5 hours a day, with their babies or while pregnant, who are really struggling, who are really having a moderate to severe PMAD. So they have anxiety, depression, bipolar disorder, all kinds of things, OCD, issues that are really making it difficult to function at their usual level. And we treat them, and we hopefully nurture them. And I think that many have described the Motherhood Center, where Paige is sitting, as kind of a womb, a place where people could come, and we're trying to create that online. And I think we've done a reasonable job of it. At least our data, our numbers show that we are equally efficacious virtually as we are in person. So I just want you to know, whatever level is needed in terms of treating PMADs, we are here to support you. And today is going to be both a celebration and discussion from the education and advocacy level of the Motherhood Center. And I'm going to stop talking and turn it over to Paige, who's going to fill you in on all sorts of other things. So welcome.
Thank you, Catherine. And because Catherine is probably the most humble person I've ever met, she did not introduce her amazing self. Catherine Berndorf, Dr. Catherine Berndorf, is a reproductive psychiatrist and the CEO and co-founder of the Motherhood Center. So it was her great passion, ideas, and commitment that made this all possible and brought us here today and allows us to provide all of the great clinical care and support that she highlighted that we make available to new and expecting mothers all across the tri-state area. And in a pandemic, we've actually gone beyond the tri-state area into other states across the US. My name is Paige Bellenbaum. I'm the founding director here at the Motherhood Center, also a proud survivor of postpartum depression and anxiety after my son was born. We have such an amazing day today, packed filled with amazing panels and guest speakers. We're going to hear from Dr. Aviva Ram, Gabby Bernstein, Rashma Saujani, and so many others. I just want to mention something that's really, really warming my heart as I see some of the chats coming through. So many of our TMC graduates, people who've used our services in the past, joining us today, celebrating the Motherhood Center, celebrating their own experience. And I just want to give the biggest shout out to all of you who are joining us that have come into the warm and welcoming arms of the Motherhood Center. For those of you who joined a little bit early today, you might have heard some beautiful songs in the background. This year, we were so lucky to join forces with Carnegie Hall's The Lullaby Project. Now, this amazing program works with new and expecting mothers here at TMC to both create and record a very personalized lullaby for either their expecting little one or new little one. And so throughout the day, you're going to hear some of these amazing lullabies that were recorded with our participants in the background. And we are so lucky that at the very end of today, we're going to be raffling off 2 very special prizes, which are opportunities to write and record a lullaby for your own baby or expecting little one with Carnegie Hall. So stay tuned at the end. We have all kinds of great prizes we're going to be raffling off. And also everybody who's joining us today, everybody who registered is going to be getting a really nice email tomorrow with all kinds of resources, discount codes from some of our partners and friends. So stay tuned. Also just wanted to mention, looking at the RSVPs and the hundreds of people who registered today, we've got people that are joining us from all over the world. We've got people coming from Canada, the UK, New Zealand, Australia, Taiwan, Indonesia, Belgium, Ireland, Romania, Austria, Sweden, Czech Republic, and that's just a few. So it is so incredibly warming and exciting to know that we were able to penetrate beyond the United States and we're able to join screens all over the world today. So I'm very excited for us now to shift gears and jump into the core of our programming. We're going to be kicking off today's very important event with really a topic that deserves all the attention in the world and something that we feel we needed to lead with today because of its relevance and importance. The title of our first panel today is Perinatal Health and Mental Health for BIPOC Mothers. Mothers of color are disproportionately affected by pregnancy and birth complications, including PMADs. Today's panel will provide information on the societal and institutional barriers that prevent BIPOC women from receiving necessary and appropriate health and mental health care in the perinatal period, how BIPOC women can advocate for themselves to ensure a more positive birth outcome, how to defeat the stigma that surrounds maternal mental health, and measures that have been taken locally and globally to improve health and mental health outcomes. We're going to try to leave the last 10 minutes of this panel and every panel for Q&A. I do anticipate, because we have such a rich and robust number of amazing women joining us today, we might run over a few minutes. We will make every effort to get to the questions that come into the Q&A. We might not be able to get to all of them, but we will do our very best. It is a great honor now for me to be able to introduce to you our moderator for the first panel. Her name is Dr. Jessica Shepard. Dr. Shepard is a board-certified OBGYN and the Chief Medical Officer for Very Well Health. She is the founder and CEO of Sanctum Med and Wellness, a wellness concierge practice, and is affiliated with Baylor University Medical Center in Dallas, Texas. Dr. Shepard attended medical school at Ross University and completed her residency at Drexel University, Hahnemann Hospital in Philadelphia, Pennsylvania. She went on to complete a minimally invasive gynecologic fellowship at the University of Louisville, where she also earned her MBA. She also served as the director of minimally invasive gynecology at the University of Illinois for 6 years. She is a well-known media personality who appears regularly as an expert on Good Morning America, The Today Show, The Talk, Dr. Oz, CNN, MSNBC, and CBS News. She has written for outlets like Vogue, Cosmopolitan, Forbes, Harper's Bazaar, Essence, and Self. Dr. Shepard's passion for women's health, from minority health disparities to reproductive justice issues, has led her to speaking engagements at events, ranging from hosting a more Black doctoral panel with Dr. Oz, participating as a panelist on the Health Body, Health Mind, Health Country with Congresswoman Clark, and the Focus of Fibroids Coalition to discuss the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021 to the 2020 Women's March in New York City. We are so very excited to welcome Dr. Shepard here with us today. Once she joins us, she's going to introduce to you our very esteemed panelists who are going to help us tackle and navigate this very important issue. As we're waiting for Dr. Shepard to join us, just wanted to encourage everybody that if you do have any chats to post, any questions to post, to please feel free to put them into the Q&A, and we will do everything we can to make it to those questions. I'm going to pause for just a moment as we welcome Dr. Shepard. As we're waiting, I'm just looking at some of the chats that are coming in this morning. Just for anyone who's interested in taking a look at our schedule, we do have it up on the website. So please feel free to check that out. And again, just a shout out for all of our TMC alums that are joining us today. Those of you who have taken advantage of all we have to offer here at the Motherhood Center. Thank you for bearing with us as we bring on our first moderator and panelists. I'm going to go ahead and get us started today. It looks like Dr. Shepard is running just a few moments late. So what I'm going to do is I am going to kick us off. We are joined by our esteemed panelists that are here with us today. And I'm just going to ask if everybody who's joining us can please just take yourself off of mute and also off or put your video on, and just let's do a quick round of introductions. Would love to have you all introduce yourselves today.
In any particular order, Paige?
In any particular order.
All right, I'll just go ahead and jump into the deep end of the pool. Good morning, everyone. My name is Estelle Raboni. I am the Acting Assistant Commissioner for the Bureau of Maternal, Infant, and Reproductive Health at the New York City Department of Health and Mental Hygiene. Good to see you all today.
Go ahead, Veronica.
Hi everyone. My name is Veronica Johnson. I'm an assistant professor of psychology at John Jay College of Criminal Justice. My research interests are primarily focused on the experiences and the psychological and emotional impact of racism and racial trauma.
Thank you.
I can follow. I'm Camille Clare. I'm a professor and chair at SUNY Downstate in the Department of Obstetrics and Gynecology, and research interests in perinatal mental health disorders, specifically mood and anxiety disorders. So happy to be here with my colleagues.
Thank you, Dr. Clare.
Hi, I'll go next. I'm Nan Strauss. I'm the Managing Director of Policy, Advocacy, and Grantmaking at Every Mother Counts. We're an organization located in New York City that works around the US and around the globe, ensuring that all women have access to care that is respectful, equitable, and high quality. Thanks for having me.
Thank you, Nan.
Hi, I'm Laura Polania. I'm one of the psychiatrists here at the Motherhood Center. My primary role here at the Motherhood Center is the psychiatrist, the main psychiatrist in the day program. And so we see women throughout their journeys into motherhood and thereafter, and try to help them navigate the shift into motherhood. I also started out as an obstetrics and gynecology intern before going into psychiatry, and use that to kind of inform the care that I give, and have spent lots of years before coming to the Motherhood Center working in community and public psychiatry. I'm happy to be here today.
And I see we've been joined by Dr. Jessica Shepard. Such a warm welcome to you. Thank you for being here today, and thanks to all of our esteemed panelists. Jessica, I read through your bio and let everybody know about the great and amazing work that you have done in this very important issue. And I am going to hand the mic over to you to introduce yourself and kick off this panel. Thank you.
Yes, thank you so much. Hello, everybody. Good morning. This is such a wonderful moment for us to discuss issues that are impacting so many women across the US. I'm going to be your moderator this morning. My name is Dr. Jessica Shepard, board certified OBGYN, and I am practicing in Dallas, Texas, and associated with Baylor University Medical Center. As you heard from my esteemed colleagues who are the panelists this morning, we are delighted for everyone to share their information, their insight, their intellect, as we discuss perinatal health and mental health for BIPOC women. We want to have everyone learn, be able to ask questions. And as I ask my colleagues questions, I really want for us to be able to share this insight, because what we do know is that there is so much work in going to eliminating racial disparities in maternal and mental health, as well as maternal and infant mortality. You know, this is something that impacts US women from all backgrounds. And when we look at developed countries, we really don't do very well when we think of numbers that have to do with bad outcomes when it comes to maternal health and also maternal and infant mortality. So I'm going to start off the discussion with Dr. Clare. You know, I want to know, why are mothers of color disproportionately affected by pregnancy and birth complications? And I wanted for you, for someone who I've known for a while, working jointly on committees in ACOG, and now as chair, congratulations for where you are. Can you share some insight on what you've seen in your experiences, and also being a leader in this world?
Thank you for the question. I think it's a very complex one. I don't think there's any one set of circumstances that we've seen. I think we still are evaluating some of the causes. For example, I sit on the Maternal Mortality Review Board for the state as well as New York City. And so as we're looking at each individual mom that has passed away, there's a lot that we need to learn about the social determinants of health, about patient experience. And so I think we don't have one answer for the reasons why moms pass away. We've addressed some of it from a patient care perspective in terms of safety bundles and the care that we're giving. So how do we address obstetrical hemorrhage and hypertensive disorders in pregnancy, as well as sepsis and some of the, cardiac conditions. So those things we're really doing pretty good in terms of providing those algorithms for the provision of care. But there are other factors that we still need to learn about and decipher and figure out how to address those. So from a sort of a birth equity perspective, how we're looking at equitable care and respectful care for birthing and pregnant persons is what we're still looking to do. We know the impact of implicit bias and structural racism within the medical industrial complex and how we can best address that. So we have a lot of work to do, but we are doing that, working with all of our colleagues, our fellow birth workers, midwives, doulas, providing support. So a lot to be done, and still, as I said, ongoing work. So made some directions, but a lot more to be done, as I said.
No, thanks for that. The Motherhood Center has really placed an emphasis on, like you said, not just addressing it from one dimension, but how multifactorial this is an issue. And so, Veronica, coming from a psychology background and knowing the impact that mental health has on, racial disparities on maternal health, what have you really seen, or what can you share with us that are institutional and societal barriers that prevent BIPOC women from receiving the appropriate health and mental health care in the perinatal period? And not only the perinatal period, but the postpartum period, which is where we know that postpartum depression also plays an impact on the ability for moms to take care of their children, or the support system that they have in order for them not to experience postpartum depression. Can you share a little bit about what that has an impact on when we think of institutional and societal barriers that prevent women from getting appropriate mental health care?
Yes, absolutely. I think my mind goes to a couple of different things. First off, it's access to care and how that access is being facilitated. So oftentimes I know specifically for African-American women, the handoff from a primary care physician or another medical doctor is really, really important in terms of getting linked to appropriate mental health services. Sometimes it really takes the provider to be able to identify some of the warning signs and then to recommend appropriate treatment for the mom. Unfortunately, that doesn't always happen, or when that does happen, there can be a lot of built-in historical stigma around what mental health treatment is and how it can maybe expose, right? It can easily be seen as shameful, right? So there's, in Black communities, there's sort of like, you don't talk about what's going on in your house outside of your home. And so the idea is that mental health really sort of exposes what should not be talked about outside of the home. We see that stigma really changing and the narrative changing, where people are becoming more open and passing along their stories of being helped by mental health professionals. And so I think there really is a great opportunity to push the narrative that mental health is something that we all should be striving for, and that can be facilitated with the help of a provider. So I really think it's access to care, of course, and being able to have access to good mental health services. The handoff is really, really important from a medical provider, and then also work to reduce the stigma when you do decide to seek mental health treatment. That can be really, really helpful.
Absolutely. I think that handoff is so important. And that actually leads me to my next question. Dr. Polania, thank you so much for joining this panel this morning. You know, as a reproductive psychiatrist at the Motherhood Center, what do you find are some of the obstacles for women of color identifying these providers? We have identified that the handoff is an important part of that. Now, how are we able to allow women to identify providers that have these appropriate levels of cultural competency? This even goes as far as to what are the things that we could do from the foundation of medical school, the training that goes into that, as well as residence programs.
Right, thank you for having me. So at the Motherhood Center, we provide highly specialized care, which is lovely. It really feels, you know, before coming into this job, I really felt like it was kind of my dream job, and it really has panned out to be that, because it really gives wraparound care to women, and helps them address and empowers them to address a lot of the different elements that kind of contribute to their mental health care. So it's highly specialized care, and not available in most places. You know, we're one of very few centers like this, and so unfortunately that I think in and of itself is a barrier. But in terms of women of color accessing and identifying mental health care professionals, I think, you know, that very specialized level of care is oftentimes something that, you know, that most women don't know about, let alone women of color and BIPOC women. And so one of the things that I think could be helpful starting at an earlier stage for trainees coming into medicine would be to really emphasize just how far-reaching the cost of untreated mental illnesses in women, particularly in mothers as kind of gatekeepers to healthcare and to health for the rest of their families, to generations, and to the people who come after them, and seeing the linkages, just the way that, you know, many of my esteemed colleagues on the panel know from their research, just seeing the layers of the effects that that mental health can have on more general health. And so one of the things that I think I saw as a trainee was being able to see that firsthand, and also, you know, as a woman of color myself, having come from a working class background, and a background where I was surrounded by people of color, and seeing how generations are affected by the health of the mother, I was able to kind of see just the way in which this really kind of affects the health of the population, and so helping the trainees coming into medicine make those connections at a very early stage, I think would be very, very helpful. A lot of medical trainees come into medicine with an idea of what their career will look like, and one of the things that I think is kind of underdone or not given attention to is just how far-reaching our help can be. In addition to that, I do think that that there just are not enough people of color going into medicine who can provide culturally competent care, and again, like our medical school training doesn't always allow for cultural competency training as a part of it, and so I think it really needs to be folded into care, into training going forward, either at the medical school level or afterwards in residency.
Absolutely. We've already, as short as we've been into this panel, been able to identify so many of the structural obstacles that come with eliminating or decreasing at this point racial biases, maternal mortality. When we think of BIPOC women, we started out with Dr. Clare explaining to us the foundation. It's so many different facets of how this plays a part, or all the different factors that play a part into these statistics, which quite frankly are disparaging And then going into mental health itself. Mental health is a separate component of how we consider our overall health. Many times we're so focused on maybe just the, outcomes of the actual physical health of a mother during pregnancy and thereafter, but mental health is a very important part. And many times, like you identified, Dr. Polania, is that this is impacted because of societal, cultural barriers within the community itself, but also there's generational trauma. There's generational trauma that can carry through, where mental health has a different impact on how we address any outcomes in the pregnancy and in the postpartum phase. And those are the things that need to be discussed in entirety before just addressing mental health in general. And so now that we have that structure and that foundation, knowing these things, Estelle, as the acting assistant commissioner in the Bureau of Maternal, Infant, and Reproductive Health in New York, what are maternal health and mental health outcomes, including maternal mortality rates in New York City?
Thank you so much, Dr. Shepard, and thank you all to the panelists. I'm very excited to be here today. I will say that in New York City, maternal health and well-being, including mental health, are critical public health concerns. While deaths related to pregnancy and childbirth have fallen overall, we still have really profound inequities that are persisting. And, just for example, during the period of 2011 and 2015, Black non-Latina women had a risk of pregnancy-related death that was 8 times higher than white non-Latina women. And Latina women had double the risk of pregnancy-related death than did white non-Latina women. And this is regardless of the socioeconomic background of those Black and Latina women. A white woman who drops out of high school has a better maternal health outcome than a Black woman with a college degree. So historically, we've often, been pointing to the socioeconomic, inputs in terms of, well, is this person a college graduate, access to education, access to economic resources, and clearly that is not the driving factor in this. For every maternal death, approximately 100 women will suffer from severe maternal morbidity. And the fact is that SMM has increased by 34% in New York City from 2008 to 2014 and affects approximately 2,500 to 3,000 New York City women every year. Unfortunately, Black non-Latina women are about 3 times more likely to have SMM than white women. Again, regardless of what their socioeconomic background is. The fact of the matter is that, as has already been mentioned here, structural racism and historical disinvestment in communities of color, and this includes, issues of redlining, predatory housing policies, and unequal funding for schools and hospitals, coupled with pervasive gender and racial oppression, are the root causes of maternal health inequities. And that's what we're trying to really impact here with regard to some of our work in New York City, and which is also happening on the state level as well, which is Dr. Clare had mentioned.
So in addition to state level, which you have so much experience with, we know that this happens across the country. So from your experience, if you could extract or give a proposal, say if you had every resource available to you, what are some things that cities and states should consider when addressing what responsibility that we have from districts, states, cities in order to help increase the resources, increase the access, or whether it's funding? What are some ideas that would be helpful for us to know or to advocate for?
As Dr. Clare had mentioned, and she's also part of our Maternal Mortality and Morbidity Review Committee, otherwise what we call the M3RC. It's a committee composed of clinicians and community stakeholders, doulas, really to focus on why are the reasons that women are dying in New York City while pregnant or within the year of their pregnancy. What are some of the factors that are contributing to that? And mental health issues is part of it. It's the goal of the M3RC to reduce preventable maternal deaths. We really try to look at a holistic understanding of each case to really determine what the cause was, maybe assess preventability and identify some of those contributory factors and some recommendations to prevent future tragedies. If there was all the money in the world, I would say more needs to be done in terms of that. More needs to be done in terms of really changing the landscape in maternity hospitals. And it's one of the reasons why we launched the Maternal Health Quality Improvement Network in 2018, which works with 14 public and private New York City hospitals that serve approximately 50% of all births to Black and Latino women. Our network actually focuses on 3 areas. We try to engage providers in improving the provision of quality care and respectful patient-provider interactions. We also engage individuals and communities in elevating their power to advocate for quality, respectful, and dignified maternal care services. That's through our birth justice defenders and implementing the New York City standards for respectful care at birth. And we also try to implement sustainable processes that address the root causes of unequal maternal care and subsequent disparities in maternal and child health outcomes. We partner, to get to the root causes, we partner with these hospitals to engage in implicit bias and trauma-informed systems training, something that Dr. Polania had mentioned. And it would be great to actually go even earlier, not to where they're already practicing clinicians, but to go into the residency programs, the medical school programs, so that those biases aren't hard-coded by the time they're already in the hospital and they're practicing. We also work with partnering hospitals to implement clinical training in medical simulation labs for the leading causes of, for instance, severe maternal mortality or morbidity, I should say, in order to improve the quality of care. And hospitals that we work with are also provided with case abstractors to really strengthen their case review and quality improvement processes. As I mentioned, the birth justice defenders also work in communities to raise awareness of the standards and really encourages birthing people to know what their rights are and to be active decision makers in their birthing experience, to know that they can demand for better treatment and really determine their own birthing experience. They're also just really great reminders. The standards are great reminders for providers to be more thoughtful in how they interact and approach Black and Brown birthing mothers. So those are just some. If we had all the money in the world, I would say that really needs to be broadened even further. There's just not enough money being invested in this work, I feel.
If I could add one thing, if you don't mind, one thing that one of the questions was, what can we do as non-healthcare providers? You can advocate for continued coverage for moms to get coverage for their first year after delivery, so 12 months postpartum, so that they can get access to mental health providers, behavioral health providers, to address all the issues that continue in the postpartum period, breastfeeding successfully, access to internal medicine, family medicine physicians, so that we can address all those medical complications that can happen prior to pregnancy. And the other thing I would mention is at the medical school level, due to the death of George Floyd and many others last year and even prior to that, medical schools are held accountable by their medical students, as well as other healthcare professional students, to address an anti-racism curriculum, as well as teaching students, residents, faculty members how to address structural racism and what it looks like. And in the MMRB and the MMRC process, how we can look at these cases from a peer review perspective, looking for bias and discrimination in the care of the patients. And so those things are very important. And mental health is really important, looking at that integrated behavioral health approach. So not just medical care, but the behavioral health care and how we can integrate that into our healthcare systems is really what the Motherhood Center is really trying to do, and how we can all do that better. So sorry to jump in before my time, but I wanted to add to all the great things that Estelle was mentioning.
No, this is wonderful. This is why we want the conversation to be fluid. I see questions coming in, which is we want those questions and we'll address those. We have 10 minutes towards the end that we'll devote to some Q&A. But I want to talk to Nan, who is the Managing Director of Policy Advocacy and Grant Making at Every Mother Counts. So, throughout this entire discussion, we've clearly identified that pregnancy-related complications and mental health disparities persist across a broad level of socioeconomic and education levels. But this pretty much points to maternal health healthcare outcomes that are overall not necessarily getting any better. So that also includes using public health and policy research, looking at state level, looking at federal resources and how we can increase that access. So we want to include policies, funding, and institutional factors as a part of this initiative as well. So for Nan, what kinds of federal and global policy changes need to be implemented in order to ensure all of these structures that we feel need to be changed when we want to ensure women of color receive that adequate level of mental health and healthcare?
Thank you so much for that question. It's really an honor to be having this conversation with all of you, particularly as clinicians, and of course, Dr. Raboni in your role in public health. Dr. Clare, you really were starting to steal my thunder there. I was getting a little worried because I, of course, very much agree with what you were saying. But in terms of looking at the policy changes that we need to see implemented, I think there are, of course, the diagnostic and treatment-oriented policy changes. There are those policy changes we need to see that are related to the social determinants of health. And then we also need to think about the prevention-oriented changes and even the language that is used and the opportunities that we have for community members to identify what the issues are that they're facing and get connected to help, because very often the language that people use in community isn't, I'm having a mental health problem, I need a mental health care provider. So it's finding community-based solutions that can connect them with people who can provide that initial level of emotional support that is so critically important, and then also make referrals and connections, and then make sure at the systems level that the structure is there to make those available. So it's really about assuring continuous and comprehensive health coverage, especially during the postpartum period, access to community-based and peer mental health support, which can include expanding access to community-based models of support, growing and diversifying the perinatal support workforce, including perinatal mental health support, and ensuring, pardon me one second, you're gonna have to wait to do that. Thanks.
As she's taking her time.
It's,
oh, you're back. Okay,
if my microwave gets turned on, I will lose my connection. So I had to ask my son to pause for the next 2 minutes and then he can make his lunch. Sorry. Thank you for your patience. We're all on, Zoom at home these days. So just getting back to that, it's also about ensuring accountability to mothers for respectful maternity care, and to make sure that we're preventing the trauma and reactions to traumatic care and re-traumatization that can happen in maternity care. So to get to those policy solutions, really one of the top priorities for this year for Every Mother Counts is to make sure that even though the American Rescue Plan made it an option for states to extend Medicaid to cover people postpartum for a full year, and to provide that full coverage, it's not yet required, and it's not yet implemented in all 50 states. So we would like to see that put into place in a more robust way, such as is the plan in a bill called the Mommies Act, which we're anticipating to be reintroduced this coming week, led by Senator Cory Booker and Ayanna Pressley, which would do a number of things, including enhancing Medicaid coverage by extending it to the full postpartum year. It also, though, increases the rates that Medicaid would reimburse by raising them up to the benchmark set by Medicare, which are typically much higher payment rates, which is really important because while we need cost-effective solutions, we also need to address the fact that maternity care in particular is really under reimbursed, making it very hard for committed, dedicated providers and facilities that want to address disparities, that want to do really strong, robust screening for maternal mental health disorders, to do them when they're being reimbursed at levels that cause them to operate at a loss when they're serving Medicaid enrolled patients. In addition, the Mommies Act would expand access to maternity care health homes, which are places that people can go sort of as a one-stop shop that provide really that 360-degree support network that people need to address their needs comprehensively. And it would make recommendations on how states can increase telehealth related to maternity care. And of course, that has major implications for mental health as well. And the other big bill package on our radar screen that we think will be essential is the Black Maternal Health Omnibus, which is a package of 12 bills addressing Black maternal health and racial disparities in maternal health. It would address both treatment and prevention. It includes the Moms Matter Act, which specifically addresses mental health resources for mothers and childbearing people. It's a bipartisan bill led by Representative Lisa Blunt Rochester from Delaware and led by New York's own Senator Kirsten Gillibrand in the Senate, and really tackles the treatment and the treatment component here by investing in community-based programs to provide mental and behavioral health treatment, including in group prenatal and postpartum care models, collaborative maternity care models, initiatives that explicitly address stigma and the need to look out for warning signs, and would include programs at freestanding birth centers, which can also be a great place for people to get care that is really a team-based model and really looks at the needs of community members holistically and comprehensively. As well, I'm bringing this to an end, but as well, there's the Kiera Johnson Act, which increases accountability for facilities and hospitals to make sure that the care they're providing is respectful, trauma-informed, and would also address discrimination and mistreatment in facilities. And then the Perinatal Workforce Act, another component of the Omnibus, which makes sure that we have a perinatal workforce that is culturally congruent, and that it reflects those who need the most support, those in communities facing the worst outcomes now. There's also attention being given to those social determinants of health that we know lead to stress and likewise contribute to mental health issues. So there are just many, many opportunities right now. There's a broader array of really strong, really robust, and really diverse provisions to improve the quality of maternity care, the quality of support services, access, and make sure that many of those services are rooted in the community and provided in a way that people find them accessible and really meet their needs.
Thank you. That was wonderful insight, because now what we've been able to provide through all these panelists is really a comprehensive framework in order to address and eliminate racial disparities, addressing mental health for women in pregnancy and postpartum, as Dr. Clare said earlier, up to a year, which would be great because I am Canadian and you get maternal care for up to a year after, which I find is so important when you think of the ability for mothers to bond with their children, also to provide the resources in order to decrease things like postpartum depression. But we know that we have to improve the access. We have constant discussions on the ways to do it, which we've identified through this panel discussion, but we have to improve that access. But that also requires, again, we've identified going back to training. Nan had brought up the Kiera Johnson Act, and having discussions with Charles, who's, her husband, in how we can also put a framework of accountability into microaggressions and implicit bias, because there's one aspect of accountability for something that may have been missed in healthcare, but also when you are able to allow the microaggression or implicit bias to be seen from that perspective, that's really where we can make some change and improve the quality that are provided to pregnant women in addressing this maternal health care issue. And also, someone had mentioned earlier, enhancing the support for families. And someone had said in the comment, yes, families are also important. In addition to providing and improving the care for mom, baby, thereafter pregnancy, is also for family support, because we know that is an important part of how we can see positive and successful outcomes in mothers, is also to provide support for the family that surrounds her and is in fact her support system. So we have one more question that I want everyone on the panel to give their a nice, quick, concise answer, if you can do that, because obviously these questions are very require a very robust answer. And then after we have everyone give an answer to this last question, then we will actually go to the Q&A, which is in the chat box. If you still have a question, feel free to submit that question in the chat box, and I will definitely bring that up to the panelists. But for everyone who's on the panel, how can we as a community help to defeat the stigma that surrounds maternal mental health for BIPOC women specifically? And how can we as a community help them access the health care that they need in order to provide that mental health support during pregnancy and postpartum? So it's a two-part question, but how do we decrease the stigma? And then how do we allow for equal access for that mental health care? I'll start out with Dr. Clare. You go first.
I was going to tag it to my colleague, Dr. Johnson, but it's fine. I think having these kind of community-based panels that are really providing the information for the community to, one, feel a safe space to discuss it. There was a time when these conversations might not have even happened because they were hidden, behind closed doors, so to speak. So providing that shared space for all of us to speak about these issues are important. Really being able to think outside of the brick and mortar of the hospital system to discuss it. So I think being sort of out of the box, working at the level of community, we really try to work with our community-based organizations to provide some of those other services other than medical care that our patients need. We know the healthcare system, but there are other systems that patients are dealing with. Social services, the housing department, transportation services that can affect their mental health and their wellness, and how they interact with their families and be productive, healthy citizens, physically healthy and mentally healthy. So just looking at those kind of out of the box approaches to taking care of our patients is really the direction that we want to have, because what we've been doing in the past is not working. So we just have to do something differently. So happy to hear from others to provide other insights as I continue to learn. Have the humility to continue to learn from my colleagues.
Yeah, I think that learning is a big part of it, because once we are aware of even our, deficiencies of where we can do better, I think that's imperative for everyone. So it's never just for one particular group who needs to learn. It's all of us who need to learn in order for us to progress forward. Veronica, what are your insights on that question?
Thank you, Dr. Clare. It's really nice to see you, by the way. But I would say that it's not, a one approach. I think the idea of community engagement is really, really important to get to a place where we start to normalize mental health struggle, right? So I think the more that we can sort of, demystify what it means to seek mental health treatment, to understand the warning signs of depression, anxiety, that can go really, really far in terms of helping people not feel ashamed and not be discouraged by the struggles that they may be facing. Working and talking with some of the wonderful MDs we have on the panel makes me so inspired because oftentimes, as a psychologist, I find myself hoping that that moms will be able to interact with MDs who can broach the subject of mental health with them in a way that's caring and considerate and culturally competent. One of the things that, my work has sort of taught me is that being able to be the first one to say something is really, really important, because oftentimes a mom may not feel comfortable bringing up, I'm having these thoughts, right? Or I'm struggling with my mood, or I'm struggling with sleep. And so having the provider really broach that for them can be incredibly empowering. The last thing I'll say on this is that for communities of color, there's a lot of emphasis on being strong and being sort of self-determinant and independent. And so a lot of times it's really difficult to seek help, especially if it looks like you're seeking help outside of your community. And so one of the other lessons that might need to be sort of spread at a community level is that there's nothing shameful about seeking help, particularly outside of your community if you are struggling, and that there are providers out there who can understand your experiences holistically of oppression, of discrimination, of microaggressions, and want to work that and infuse that into your treatment in a way that doesn't shame you or blame you for the types of symptoms that you're having, but looking at it as a combination of, personal factors and also the oppressive systems that we navigate through.
No, I think that's important. You had brought it up earlier as you started about demystify. When it comes to stigma, it has to be a constant conversation, and then it's not uncomfortable anymore. But also demystifying that mental health is part of our overall health and not just one portion of it. And then also the kind of barriers that we put to it is because of the stigma, whether that's even in society, how we project that on TV, in media, social media as well, is that we really have to, one, as Dr. Clare said, think outside the box, demystify the stigma. And then Dr. Polania, what did you want to add to this question, or this answer rather?
Yeah, I mean, the thing that keeps coming up for me is perhaps like not a tangent necessarily, because I do think these things are intertwined, but destigmatizing and demystifying is an important thing, I think, for the community to reach out for care. I also, equally as important, I think there has to be a lot of healing that's done between medicine and its consumers, or medicine and patients, to undo some of the kind of the intergenerational trauma that's happened along the way, whereby mental health is criminalized, really, and as is like a dozen other issues that add to the oppressive institutions that people experience and stop them from getting care. And so it really, I think we hit Dr. Shepard, you hit the nail right on the head with opening up the discussion, starting with how we can start to approach some of these questions from a greater perspective than just simply hoping that people will come to us.
Thank you. And Estelle, let's hear from you, ideas on an overall perspective on take the stigma away, and then also some resources to help mental health be more impactful or maybe noticeable even to women.
So the first thing that leaped to my mind was that Black bodies are heavily surveilled. And because they are heavily surveilled, a mention of mental health challenges doesn't trigger necessarily, let me connect you to the support service. It connects to the correction aspect, to the criminalization aspect. It's a very real fear in the community. If I admit to this, do I make my family vulnerable? Do I lose my child? Am I suddenly seen as an unfit mother? And how do I put myself and my family and my infant at risk? And so we need to take that out. I mean, that just needs to be taken out. I think we're starting to see some changes in that respect on a different topic in terms of toxicology, drug testing on, birthing women and infants and things of that nature. And we're starting to see a change there, which I hope will spill over into other areas, including, mental health issues. But I think it's also systematizing assessments. So we have newborn home visiting programs in New York City. We also have nurse family partnership. That mental health assessment is just part and parcel of the entire relationship that home visitor or that nurse has with that mother and that family. And I think that needs to be part of it. And then we also have to change the social conversation. There's so many great social media influencers that can really speak to this and make this just a normal and acceptable part of the conversation. Everyone, especially now, we're in a pandemic. We're finishing this pandemic. It has had an enormous toll on everyone's mental health. And we're not immune. None of us is immune. So it's okay to talk about it. It's okay to seek services. How do we navigate the system? How do we connect people to those services? And that's the next step. But we really need to take all of these issues into account, that there's real fear in the community. And how do we address those fears and say, no, that's not going to happen. We're going to address that and make it safe to ask for this help.
I think, one of the words that resonate most from what you just said was safe. Having that reassurance, having that comforting, almost nurturing aspect of what mental health can provide, and the outcomes of what can happen for you, for your entire holistic health, your ability to relate to your family, your child, stressors that you have that are both triggered from being someone who's BIPOC, also from whether it's from your job. I mean, there are so many different things that really account for the mental health of BIPOC women, especially during pregnancy, which is already another added feature of stress. And so I think we need to also ensure that we are projecting the services as something that is so needed, necessary, that they will be heard. That's another thing, is taking away that desensitizing, from this is a moment where you get to be vulnerable. Vulnerability is very hard for BIPOC women because of what's already been slated against them or how they've been projected, microaggressions. And so that's a lot to unload, to therefore go forward into another state of vulnerability and being able to peel back the layers of the grief and trauma that you felt, not only throughout your lifetime, but generationally have impacted the way that you visualize your life and your journey throughout this, this time on earth. So I think that those are things that, even daily, that I need to readjust when I, have moments with patients where I need to allow them to be vulnerable, is to allow them also to be heard and safe at the same time. So thank you for that answer. And what do you want to finish off this last question throughout our panel before we get to our Q&A in the Q&A box?
Yeah, I loved what one of the speakers had said before about really having a variety of approaches. We need to have a connected system. It is so important to have providers who are specialized mental health providers. It's so important to have OBs, pediatricians, everyone in the system helping families to identify when they need to be or can be connected to mental health support services. But also, most of the time, people aren't in those spaces. they're at home, they're on the internet, they're hopefully talking to friends and family. And so we need support services for those times as well, and ways to reach people in those other times and spaces when they're not with a provider. So what are the spaces that can meet people where they are, both figuratively, as we often use that phrase, but also literally where they are, especially in the context of the COVID-19 pandemic, when there's been so much both unmet need for emotional and mental health support and so much more isolation and uncertainty than normal. And one of the real opportunities that I see is through peer support specialists, people with that lived experience, trained to help others who are struggling, people from their own communities, and people who are really talking about their own relatable experience, or not talking about, but coming from a place where they can provide support rooted in their own experience. And that really addresses stigma as well. It is also cost effective, and it is meeting people where they are. We, Every Mother Counts, over the last year has partnered really closely with Ancient Song Doula Services, Village Birth International, and an organization called Jacaranda Health to create Just Birth Space, which is a perinatal support platform that's grounded in those community-based models to provide this kind of free, personalized, non-clinical support where there are referrals to clinical options as needed, but it also provides people a place to text, Facebook message with real people, people who are trained in providing that community-based support to answer questions as they arise, to address people's stresses, address social determinants of health, and make those referrals. And I think that we need to find and support and integrate into the system more models like this that create opportunities for people to seek out support at all different levels, and then build connections between those components of the system to make it more seamless for the individuals to navigate through and get different levels of support as needed.
Thank you. So now we're going to go to the Q&A. I have a few that I feel can be directed to panelists just as how they were written. But if you want to, jump in panelist perspective, please feel free. We want everyone's opinion throughout this last 10 minutes. There was one of the questions that was more of a comment, but a question at the end, basically discussing when we think of perinatal mental health and how when we see the numbers, when you look actually at the numbers across all physicians, only 6 to 7% are African-American. I think it's 8% for Hispanic. So they're still relatively low. So as we're, kind of taking now mental health, which, has it's kind of like a niche, I guess you could say, of medicine. We know that those numbers are probably even lower when we think of BIPOC providers who are in psychiatry, psychology, and any mental health capacity. From a perspective of psychiatry, Dr. Polania, Dr. Clare, what do you think are some creative ways or some ways that we can increase the amount of BIPOC providers who are psychiatrists or mental health providers? She's reflecting to you, Dr. Polania. She's like,
you can start, Dr. Polania, as a psychiatrist, if you'd like.
Yes, I mean, I think this kind of comes back to kind of inequities in education and access to higher levels of education, having being able to get physicians who are BIPOC kind of more center stage, and reaching out and working with their communities to be role models and to show younger folks that we're here and that we have a role and can make a large impact in the medical community. I think it really comes down to that. It also is about making higher education a little bit more accessible and affordable. And then again, you know, one of the things that I think a lot of my colleagues in medicine kind of go into medicine kind of feeling like you need to kind of know what it is that what you need, what you want, and kind of gun for it, so to speak. Like I think really emphasizing the role of primary care and of mental health as kind of a foundation for healthcare and for uplifting the health of communities, I think is very important, and something that's that we don't, you know, get enough of in our training.
Great. Dr. Clare, now I have one for you. So you got relieved of that question, but now I have one for you. Because you are chair of an OBGYN department, you have the ability to work with providers outside of physicians, such as midwives, doulas. Can you give a quick answer on the role of doulas and how they actually play into addressing racial disparities when we think of perinatal mood and anxiety disorders, how they contribute to actual mental health throughout the process of a woman's pregnancy, delivery, and then also postpartum?
I think doulas play an extremely important role in providing support as a key member of the birth worker team with obstetricians. We have family medicine doctors who also provide obstetrical care in our hospital. So we're all key members of the birth worker team: midwives, OBGYNs, family medicine, doulas that are providing support. We saw during the COVID pandemic the role of not having support at the time of the birth experience is extremely detrimental to our patients. And so doulas are an important part of providing that additional support prenatally, during the period of labor and delivery, and postpartum. Really critical. That whole lifespan of the experience is really key. So we advocate here for increasing their services for us, for our patients, making sure they're equitable and they're affordable for everyone. It can be expensive if you're providing that without coverage. And so really working with our colleagues to have them help us provide additional support for our patients is really, really critical. Midwifery care as working as a member of our team as well is super important. Nurses, we don't work alone. We never work alone. Our anesthesia colleagues, our behavioral health colleagues, it's the village. We are the medical and mental health services village that our patients need, and everyone plays a critical role in making sure our patients do well all throughout the pregnancy, the birth experience, and beyond. Because it's the beyond. We want them to go on to other pregnancies and see their families grow up. And so it's very, very important. And how we can encourage that through legislative help that Nan referred to is super, super important.
Thank you for that. I firmly believe that we are impacting our future generations if we can support mothers during pregnancy, because, from a medical perspective, we always know that even at the cellular level, what stress can induce on an unborn child and then future play out in just their ability and how they're able to function is something that sometimes we don't think about. But that is why this is an entirety and requires so many people to be a part of it. I'm going to ask one more question. This one's for Veronica. This one I feel is help us round out this session. How do you see families accessing support for the parent-child relationship beyond their postpartum period?
Yeah, I love this question. I'm a big advocate for, like I've said before, a holistic approach. And so I think the idea of bringing the family into treatment can be in a really wonderful way of sort of supporting the family with the guidance of a mental health professional. So there are dyadic treatments between parent and child. There are family treatments that include anyone who's willing to come in, right, and discuss dynamics. And so I think these services are really wonderful. Again, we have a lot of issues with like available providers, available culturally competent providers, but in the instance where a family or parent and child can get into treatment, it can be powerfully important in terms of managing relationships dynamics going forward. So not always accessible, not always available, but when it is, can be powerfully important.
And I'm glad you brought that up, that it's not always accessible, but that's what our focus is in panels and discussions like this, is how do we make that more accessible so that we have so much support for mothers and their families and their support system in order to make this journey one that impacts mom in a positive way. And then, like we said before, the future generation, and how we can make sure that we're setting them up for success. So I'm so honored to have served as the moderator to a very esteemed colleague panelist, and I hope that we continue to have these discussions, specifically when we think of mental health and how that can impact BIPOC women. We need to ensure that this is not something that starts here, stops here, but it continues. This actually is being recorded, so this should be available for anyone who wants to look this over, to share this with someone. But we thank the Motherhood Center so much for allowing us to be vocal, to share our expertise and how we can all collectively come together as a team, because this is a team effort and we want mothers to thrive. So thank you very much. And that is going to conclude our panel. And if you have any other questions, you can direct that again to the Motherhood Center and they can get you that access. So thank you to each of the panelists, and we hope to see you soon.
And I just want to thank everybody, Dr. Shepard, for doing such an amazing job, and to all of our panelists for having such a powerful and important conversation. Thank you very much. We will continue the conversation, and I can't thank you enough for joining us.